Did you know that liver cancer ranks 8th among the most common forms of cancer in the world? For every 100 people diagnosed with liver cancer, 95 might not survive the disease and die. Here in the Philippines, liver cancer is the 3rd cause of cancer among men and 6th among women. Joining us is Dr. Maria Vanessa de Villa, head of the Center for Liver Disease Management and Transplantation of the MedicalCity. Doctora, welcome to the show.
Hi, good evening.
Now, earlier we talked about basically the basic functions of the liver and how it becomes liver cancer. Now, Doctora, what are the common symptoms of someone who has liver cancer?
Oh, as I said earlier, liver cancer is a silent killer. So many times there are no signs or symptoms. And usually when they manifest, when the patients begin to feel something like bloating, some heaviness or weakness, it's usually already kind of late.
Okay.
And the cancer is already rather big.
Now, what do you think, Doctora, is the best way to catch liver cancer early then for...
Yeah, the best way is to have a screening program, you know. Since hepatitis B is a common risk factor, it's very common in the Philippines, it would be good to have a way to screen the population at risk for this kind of cancer. But as yet, we don't have a national screening program. So if you go to doctors who are aware, then they may periodically test you and watch you so that they can detect the cancer early.
Okay. And how is liver cancer diagnosed naman, Doctora?
Usually, it is diagnosed when you detect a mass in the liver, you know, in your bukol sa atay, and then it will have to be investigated. So there are certain blood tests that we do to be able to figure out what kind of cancer this is. We also try to identify if there are risk factors in this patient. As was said, most common in the Philippines is hepatitis B and a condition called cirrhosis.
Okay. Now, Doctora, if someone is diagnosed with either hepatitis B or hepatitis C, what are the chances of that person actually having liver cancer later on?
When the disease becomes, because it's usually a prolonged condition, and the liver damage occurs later on in life. Of those with hepatitis B, a good 25% of them may develop complications like liver cancer and cirrhosis. So the doctor just has to have a high index of suspicion if the patient has the predisposing factors that may lead to this kind of cancer.
Okay. Now, Doctora, you mentioned earlier that one is diagnosed to have liver cancer once may bukol na nakita. And this is by ultrasound or maybe CT imaging. But once na nakita may bukol, automatic liver cancer na ba yung, Doctora? Or are there stages or levels of liver cancer?
Not necessarily, no. So we have to do some tests to figure out what type of cancer it is. When you say liver cancer, you might say you can classify them into two, primary or secondary. So primary liver cancer is the cancer that arises from the liver. Okay. And there are basically two types. Because you have cells in the liver called hepatocytes, they make up the bulk of the liver, and then the cells of the bile ducts or the cholangiocytes. So if the cancer arises from the most of the cells of the liver, it's called hepatocellular carcinoma. If they arise from the bile ducts, then cholangiocarcinoma. So each one has sort of risk factors, and then there are ways of detecting. You can do tumor markers. We usually detect them early on by ultrasound, but when you do contrast imaging like a CT scan or MRI, then there will be features in those imaging studies that will tell us more or less the type of cancer it is.
Okay.
So you have to take it in context, the risk factors, the lab test results, and the imaging studies.
Okay. Now that you mentioned, Doctora, let's talk about the risk factors for someone to have liver cancer.
Yes.
What are the more common risk factors for Filipinos, maybe in your practice?
Correct. In this country, viral hepatitis, especially hepatitis B, so history of that disease, and then a condition called cirrhosis. So when a patient has cirrhosis already, then the liver becomes a tumor-generating environment. They are more prone to develop liver cancer when they have cirrhosis.
Okay. Now, Doctor, you also mentioned earlier that liver cancer is a silent disease. By the time that the patient manifests symptoms of the disease, medyo too late na.
Yeah.
So what could be a good age to start screening maybe? Doctor earlier said that sometimes ang earliest is sometimes at birth. They are acquired from an infected mother. But siguro from someone who isn't infected at birth, there are other ways to get hepatitis B. What's a good age to start monitoring, screening oneself?
It usually, as I said, it appears later on when the liver is already damaged, or it may also appear in livers that are not yet cirrhotic, if you have other risk factors. So in adulthood usually. So in men above 40, and in women above 50 are, they say, more prone to developing this type of cancer.
Okay, and is this just a simple screening? Can someone just go over and request, what should they request from their doctor?
An ultrasound, usually.
Ultrasound of the liver.
Recommended screening tools are ultrasound of the liver and a blood test called alpha-fetoprotein. It's a tumor marker more specific to this kind of cancer. No?
Very good information, Doctora. We talked about pretty much from the symptoms. Next, we'll be talking about management for it. What are the available treatments for that? But before we do that, we'll be right back after a short break. You're watching MedTalk on CNN Philippines. Welcome back to MedTalk. Here are some myths and facts when we talk about liver cancer. First, people suffering from cirrhosis are at risk of developing liver cancer. Survival rate is 0% without treatment. Second, 80% of liver diseases are attributed to hepatitis B and excessive alcohol consumption, and the remaining 20% is linked to non-alcoholic steatohepatitis or fatty liver disease. And third, liver cancer is one of the most common causes of death worldwide. In 2012 alone, 746,000 deaths were recorded due to liver cancer. You're also watching MedTalk, and so joining us is Dr. Maria Vanessa de Villa, head of the Center for Liver Disease Management and Transplantation of the MedicalCity. Now, Doctora, let's get into the treatment phase now. So we talked about the symptoms of liver cancer, how we can diagnose that.
Yes.
Treatment. Once someone is diagnosed with liver cancer, what are the treatments available for this patient?
Okay, it depends on how big or on the extent of the tumor at the time of diagnosis. The treatment that offers best chance for cure is surgery. Removing the tumor in as far as you can still remove it. But as I said earlier, 80% of the time we cannot remove the tumor anymore by surgery. So you will have to think of other treatments for those types of patients. But as much as possible, if we can remove the tumor still, then that's what offers the best chance for cure.
The success rate of the surgery for this tumor, let's say you find the tumor, depends on how big the tumor is.
The extent, in terms of size and number, yes, and the condition of the liver as a whole, the degree of cirrhosis, whether there's cirrhosis or not.
So not everyone can undergo surgery for liver cancer when the tumor extends too much, when the tumor is too big or extends too much into the liver, surgery is no longer an option.
Yeah, it depends really. So we need to know the size of the tumor, the number of tumors. Does it affect two sides kasi yung liver, right and left, but they're together. So we need to know the extent of the involvement, are the two lobes involved, what other structures are sort of near it, connected to it. So we try to assess based on those. So if we can clear the liver of tumor by removing it through surgery, and if the rest of what will remain is still normal or good enough for the function of the person, then you can probably remove the tumor by resection or cutting that part of the liver that has the tumor.
Okay. Now after liver resection, can the person who just underwent surgery still live a completely normal life, still doing the same things they normally do?
Sure, yes. That's the goal. No? That after surgery, the person will be able to go back to normal life. No?
Okay. Now, is there anything that they have to watch out for, or anything? Well, obviously, if they're been taking alcohol a lot, they should do that. But is there anything really specific for someone who has undergone liver resection surgery that should be sort of watched out for?
Yeah, certainly. You have to watch them, monitor them. because the chance of recurrence is high, very high, especially if that liver is already damaged by fibrosis or cirrhosis. The recurrence is as high as mga 70 to 80%. So we advise these people to come for regular surveillance. Usually we see them every 3 months and request for blood tests and imaging studies to be able to detect whether there will be a recurrence or not. So if you catch it early, still small, then you can adequately manage it.
Now, roughly, on the ballpark figure, what is the cost of this type of surgery? This type of liver resection, or even up to you can do a liver transplant surgery?
It depends on the extent of surgery you will do and where you will do it.
This is major surgery, so what I'm driving at is trying to prevent this type of disease will have more benefits in the long run. Is there something in the diet that you would recommend for the Filipinos to watch out for?
Fatty liver is very common here, so we definitely would recommend diet and exercise. There is no magic pill yet for fatty liver, and nothing beats diet and exercise to date. So we're studying a lot of things out there, but still it is important to eat healthy, to move, and to exercise regularly to take care of your liver. This is probably something new, but it's definitely what liver specialists would recommend.
Okay. So since you mentioned the fatty liver, can you explain to our audience what are the major causes of fatty liver?
Major causes of fatty liver. Well, in general, when one is fat, when you have excess fat in the body, there is also excess fat in the liver. And then, one other condition that can cause this is alcohol. That's why alcohol linked to fatty liver, you should try to avoid alcohol as well. But in general, conditions that would lead to excess weight, maybe diabetes, being overweight or obese, those are the conditions that will also likely bring fatty liver. No?
Okay.
Some people think, if you have fat na sa liver lang but not elsewhere.
Right.
So that's really not true. If you have excess fat in your body in general, there will likely be excess in the liver as well. But having said that, fatty liver is also seen in some thin persons. So there may be fatty liver in the lean as well.
Okay. Now, Doctora, a lot of Filipinos are actually mahilig sa mga herbal. They take the herbal supplements at times, and they think that this herb is probably specific. You see a lot of advertisements to enhance the liver. What's your take? Would you recommend these things? Are these good for supplements for the liver?
Favorite question. In general, these supplements may be good, but usually there is no proven benefit. That's why they also put it there, that there is they don't claim there's no therapeutic benefit. Again, more of healthy lifestyle, move around, eat healthy, rather than spending money on these supplements.
Even with some of our patients, when it comes to cancer, when we're talking about cancer, I think
prevent is best.
Prevention is best, definitely. Do you have any advice, Doctora, for audience regarding liver cancer and how to prevent or be aware of it?
Yeah, well, in general, take good care of your liver. You have only one. So try to avoid whatever may damage it. As was said earlier, hepatitis B, be tested. If you don't have the virus yet, be vaccinated so you don't get it. And then take care of your liver. Avoid excessive alcohol, too much fat, exercise, and seek advice early when you start to feel something. So taking care of your liver will help prevent cancer. And when you start to feel something already, then go to the doctor who can help you.
Good advice, Doctora. And with that, we'd like to thank Doctora Vanessa de Villa for being here on MedTalk. I'm Dr. Freddy Gomez. Thank you for watching.